Footnote number 79. How many improper ambiguous names to do not these works contain, under each of which are included excessively different morbid conditions which often resemble each other in one single symptom only, as ague, jaundice, dropsy, consumption, leukorrhea, hemorrhoids, rheumatism, apoplexy, convulsions, hysteria, hypochondriasis, melancholia, mania, quinsy, palsy, etc., which are represented as diseases of a fixed, unvarying character and are treated on account of their name according to a determinate plan. How can the bestowal of such a name justify an identical medical treatment? If the treatment is not always to be the same, why make use of an identical name which postulates an identity of treatment? Says Huxham, a man as clear sighted as he was estimable on account of his conscientiousness, and in like manners Fritz laments that essentially different diseases are designated by the same name, even those epidemic diseases which undoubtedly may be propagated in every separate epidemic by the peculiar contagious principle which remains unknown to us, are designated in the old school of medicine by particular names, just as if they were well known fixed diseases that invariably recurred under the same form as hospital fever, goal fever, camp fever, putrid fever, bilious fever, nervous fever, mucus fever, although each epidemic of such roving fevers exhibits itself at every occurrence as another, a new disease such as it has never before appeared in exactly the same form, differing very much in every instance in its course as well as in many of its most striking symptoms and its whole appearance. Each is so far dissimilar to all previous epidemics, whatever names they may bear, that it would be a dereliction of all logical accuracy in our ideas of things where we to give to these melodies that differ so much among themselves one of those names we meet with in pathological writings and treat them all medicinally in conformity with this misused name. The candid Sydenham along pursued this when he insists upon the necessity of not considering any epidemic disease as having occurred before and treating it in the same way as another, since all that occur successively, be they ever so numerous, differ from one another. Nil. From all this, it is clear that these useless and misused names of diseases ought to have no influence on the practice of the true physician, who knows that he has to judge of and to cure diseases not according to the similarity of the name of a single one of their symptoms, but according to the totality of the signs of the individual state of each particular patient whose affection it is his duty carefully to investigate but never to give a hypothetical guess at it. If, however, it is deemed necessary sometimes to make use of names of disease in order when talking about a patient to ordinary persons to render ourselves intelligible in few words, we ought only to employ them as collective names and tell them For example, the patient has a kind of St. Wit's dance, a kind of dropsy, a kind of typhus, a kind of ague, but in order to do away once for all with the mistaken notion these names give rise to, we should never say he has the St. Vitus dance, the typhus, the dropsy, the ague, as there are certainly no diseases of these and similar names of fixed, unvarying character. Explanation of footnote number 79. There are so many different morbid conditions which are given improper, meaningless names and they are similar to each other in one single symptom. Such diseases are considered of a fixed character and they are treated on account of their name according to the fixed plan. So, how these identical names of the disease postulate an identity of treatment of diseases. Essentially, different diseases are identified by the same name. Even epidemic diseases which occurs by peculiar contagious principle, they are given particular name by the old school, just as it they were well known fixed diseases that always recurred under the same form as hospital fever, gold fever, camp fever, putrid fever, bilious fever, nervous fever, mucus fever. Although such a fevers exhibit itself as another disease fever at every occurrence, it has never appeared in exactly the same form, differing very much every time in its course as well as in many of its striking symptoms and in its whole appearance. Each one is so far dissimilar to all previous epidemics, whatever name they bear, and all are treated medicinally in support of these misused names. Candid Sydenham alone pursued and said that do not treat any epidemic disease as they have occurred before and do not treat it in same way as another, since all they occur one after another and they are in multiple forms but differ from one another. From all this, it is clear that these useless and misused names of diseases should not have influence on the practice of true physician. True physician knows that he has to cure the disease not according to the similarity of the name of their single symptom, but according to the totality of the signs and symptoms of the individual state of each particular patient. It's physician's duty to investigate properly about suffering of the patient and not to guess hypothetically. If, however, it is quite necessary sometimes to make use of names of diseases when talking about patient to ordinary person to present ourselves intelligible in few words, we should employ the names of diseases as collective names and tell them the patient has a kind of typhus fever and kind of ague fever. We should never say that he has typhus fever or ague fever, because no diseases of these similar names of fixed unvarying character, every diseases differ from the another disease.